Today on Living by Design,
We're having a conversation about lupus.
But what people need to know, and I'm so glad to be on this show, is that lupus can infect the internal organs of the body.
I also had my niece on that
Oh,
same
yes.
show because she has lupus.
today on Living by Design. Tony Lamont presents Living by Design with host Kathy Holloway Hill. Kathy is a strong, powerful voice. She entertains, informs, and inspires her audiences everywhere she goes.
Hi, I'm Kathy Holloway Hill, and welcome to the Living by Design show. And I am so thrilled to be with you another week. We have the pleasure of speaking to the magnificent, amazing Dr. Karen Rodman. We received so many email notes about the lupus show that I wanted to have a conversation with someone who is in that realm from a neurology perspective so that she could give us a little bit more information that's going to help you. Karen, welcome to Living by Design.
Thank you so much. I'm so happy to be here.
And I am happy to have you here. I just think you are awesome and amazing, so I just had to get that out.
Well, this is a mutual admiration society because I think and I know you're awesome and amazing too.
Oh, thank you so much.
You're welcome.
Now, lupus, we know that that is a very serious, debilitating disease, and it can be fatal.
Yes, it can.
And as you know, recently I had an interview with the Lupus Foundation of America. It was the Indiana chapter. And we received a little bit of information, but not quite as much as I would have wanted to receive. It was more of an informational interview with the CEO of the Lupus Foundation, the Indiana chapter.
Yes.
And it was more informational where people can go, you know, as resources, resource-wise. But what I really wanted to dig into is how lupus can affect the body from a neurological perspective. And so I'm just going to ask you to just jump in and whatever you think our viewers could benefit from, let's just start there.
Okay. Well, as you know, lupus is a autoimmune or chronic inflammatory type condition where basically the connective tissues are affected. It tends to be diagnosed by an unusual skin condition with various types of rashes on the face and possibly other parts of the body. And a rheumatologist is the specialist that primarily treats it. But what people need to know, and I'm so glad to be on this show, is that lupus can infect the internal organs of the body, such as the heart, the lungs, and the brain, as well as the peripheral nerves, the spinal cord, and of course as a neurologist, when lupus affects parts of the brain or the spinal cord or peripheral nerves or muscles, that's when a neurologist can become involved.
And the interview that I had, I also had my niece on that
Oh,
same
yes.
show. And she was, because she has lupus, and she was giving her experiences and how she came to discover. She said it took 2 years to diagnose her, but
know.
what really happened is she got pneumonia. And the pneumonia turned into a really massive thing, and she didn't understand why. The doctors didn't understand why. Supposedly they gave her a ton of tests, but it didn't show anything. So what's up with the testing?
Well, and I think in your lovely niece, and she did an excellent interview, I saw that show,
Oh, I love
is
it.
that her type of lupus tended to present with internal organ damage first as opposed to the rash.
Oh, is that unusual?
Not, it's not the most common, but it's something that you should think of. I think it's important in someone like your nieces and other people's cases so that lupus is diagnosed quicker is that certain type of lab tests, such as an ANA, an anti-nuclear antibody, ENA, extractable nuclear antigen, anti-double-stranded DNA, lab tests, which are a little bit unusual but can be ordered by a family doctor or other specialist. If that had been done sooner, they might have been able to have diagnosed them because they would have come back extremely abnormal. And from a neurology point of view, if we see people who present with certain types of atypical strokes, certain types of atypical movement disorders or seizures, neurologists will do blood tests for lupus.
Wow.
What is interesting from our standpoint is when lupus might affect the brain, you can get an inflammation in the blood vessels in the brain called vasculitis, which can lead to a stroke or strokes in someone who may or may not have lupus. People with lupus can develop vegetations or small emboli on their heart. They call it a sort of a non-bacterial endocarditis, and those can be pumped from the heart up to the brain, which can cause strokes in a person with lupus. So obviously we must understand that lupus is a systemic disorder. It can be the skin, but it can affect the internal organs. From a neurologic point of view, sometimes people with lupus, a small percentage, may present with seizures, which we would treat.
First, or just once you're diagnosed?
You tend to get it once you're diagnosed.
Okay.
There is a percentage of people who will get the internal organ damage first before maybe the skin manifestations may or may not come.
Wow.
Which may have been the case with your dear niece. Wow. And again, I'm not a
So there's no rhyme or reason as to how it manifests.
It's usually the skin. That's the most common, but it can be other things. So that when a neurologist sees, especially younger adults with strokes, we will check for lupus with an ANA. And if that comes back highly positive, we'll get an anti-double-stranded DNA lab test and other things. Certainly lupus, one area it affects very commonly is the kidneys, and people can go into kidney failure and sometimes even need transplants and need to see a kidney specialist. That can be another, and again, that's not my area of specialty, where lupus can be affected, can affect internal organs. Rarely it can affect the spinal cord, so that you can get an inflammation or a myelitis and, present with paraplegia. I would say one of the more...
Paraplegia?
Being paralyzed from the waist down, not being able to walk or use your legs.
Absolutely. It sounded like that when I...
sometimes people with especially more long-standing lupus can get peripheral nerve damage, or what we call neuropathy, where the peripheral nerves, usually from an autoimmune inflammatory response, are damaged, and you can get numbness, tingling, burning in the hands and feet. Certainly there are treatments for it, prednisone or steroids. There are drugs which we call immunosuppressants, like Imuran or Cellcept, to name a few, or Cytoxan, which can treat, more extensive lupus. Monoclonal antibodies, which are very powerful, can be used to treat lupus, such as Rituxan or rituximab. Or, and I don't know if your niece is on this, some of the malarial drugs like Plaquenil is also used for lupus.
Well, I'm going to stop you right there, Dr. Karen Rodman, because my head is spinning. You are absolutely awesome, and as you can see, we have a lot more to discuss on this topic and a few other topics coming up. Stay right where you are. We'll be right back.
No. No.
No.
No.
No. No lupus.
No lupus.
If we're going to say no to lupus,
We need to know lupus.
Lupus has completely changed my life.
Lupus is one of those things that takes over somebody's body and you don't know anything about it.
It's just unpredictable, it's tricky, confusing.
There's certain things that I can't do, but I still get up every morning and do it.
It's really a cruel mystery.
Lupus can impact any organ in the body, any organ. It was attacking my kidney. Some people it's the brain, it's the heart.
I had gone into stage 4 kidney failure, which sent me into respiratory failure, which almost made me lose my life.
When I was first diagnosed, that's when it really kicked in, just knowing that there was no cure.
I really felt like maybe I might not be able to make it through this.
We don't look like we have the disease, and I think that's also part of the problem.
You can be sick even though you don't look sick.
That is one of the cruel aspects of it, is there sometimes people don't believe you.
Lupus does not discriminate. It can affect men, women, white, black, older, younger.
I've had lupus for 10 years.
I am 17 years old.
I am 11.
We've got to find a way to get through this.
The Lupus Foundation of America is a great organization because they're getting people out there, letting people know what it's all about.
And by knowing more, we'll be better able to help and unlock the mysteries that do surround lupus.
There is something we can do. There is hope.
Let's take this moment and turn it into a movement.
End the confusion and end lupus.
There is hope. We just have to get involved. I haven't given up.
I challenge you to know.
No.
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 No, lupus. Go to lupus.org/no and help solve this cruel mystery.
Welcome back. We're still here with the brilliant and, oh my goodness, just so very knowledgeable Dr. Karen Rodman. And we're having a conversation about lupus and all of the misunderstandings and information that we really truly need to know. This is so valuable. Now, Karen, prior to the break, we discussed some of the medications. Let me just shift a little bit and talk about my niece's father, who's my brother.
Okay.
For quite a long time, he had a rash.
Ah.
And nobody ever knew what it was. I mean, this is when Brittany was a baby. When when the children were small. And he had that rash for a long, long time, and everybody ignored it. He did go to the doctor to see what it was because, you know, and when you think about that butterfly shape, whatever they call it, when I think back on it, that's exactly what it was. But the doctor said, oh, it's psoriasis. Oh, it's eczema. Oh, we'll give you some skin cream. Nothing they gave him ever made that rash go away until he was finally diagnosed. I think he was diagnosed with external skin lupus.
Yes.
And they gave him some steroids or something, and that's the only thing that made it recede and stop. So my question to you is, one, is it hereditary? And two, even though he had that external rash, why did he not ever manifest any internal organ symptoms? Because he never, well, you know what? He did have a stroke.
Oh, okay. Well, first of all, is it hereditary? I would say, you know, sometimes connective tissue diseases such as lupus can run in some families, such as, well, if one member has lupus, someone else may be more prone to have another connective tissue disease, let's say like rheumatoid arthritis or maybe scleroderma. But in many cases, it's not.
Okay.
You know, so anyone, you know, could potentially get lupus, although, as I'm sure you've been told and know, it tends to be far more common in younger women.
Right, I've heard that.
I think what's unfortunate...
African-American women, actually.
Absolutely. What I think is unfortunate in your brother's case is that he was just dismissed as some sort of non-specific skin disorder.
Right.
And if they had done some of the lab tests, the ANA, ENA, anti-double-stranded DNA, ribonucleic protein or RNP, one or all of those would have been highly abnormal and they would have diagnosed it and been able to treat it sooner.
And I would think they didn't even try to biopsy. Would a biopsy of the skin?
That might have helped, absolutely, because at the very least it would have excluded what it was or what it was not. Right. They would have excluded psoriasis, they would have excluded some form of eczema, they would have excluded some form of atypical skin cancers. So, and I'm just sorry that that did not happen.
Right.
And if they had, they might have looked at when your niece was, his daughter was diagnosed, they might have said, you know, although it's lung internal, perhaps this could be, since she does have a close relative, a parent, maybe they would have diagnosed her sooner. I think what is important to note is that these lab tests, although they aren't the most common of lab tests, can be ordered by any specialist at any time.
Not just a neurologist.
Not just a neurologist, your family doctor, internist, dermatologist. And, it can possibly be diagnosed and treated sooner because, as I remember from your other wonderful show, I was told it can take a minimum up to 2 years to be diagnosed.
Right. Now, and that's what it took for my niece. It
Yes.
took her 2 years, even though she was 16 years old with pneumonia. And she even explained, and I may be getting some of the facts wrong, but she explained that they gave her an oxygen test or a breathing test of some sort to measure the amount of oxygen that she should be able to have. And I think the norm is up in the 90s.
Yes.
And hers was 55.
Yes.
And that should have told them it's not just a typical pneumonia.
Absolutely. I when I thought of what happened to your niece, I remember saying, wow, other autoimmune diseases like sarcoidosis can affect the lungs. And I was saying, did they even check for things like that?
My brother has that.
So, those are important things to check. To follow up on your other question, some people, and again, a rheumatologist is the absolute expert on lupus. There can be different manifestations. There are some people with lupus who only have the skin or outer skin manifestations.
Yeah, exactly. That's what
and they do not get any type of internal organ damage.
Okay.
And others, and again, I'm not quite sure the percentages, can have a combination of both.
Okay.
They can have, the outer rash and or internal organ damage, kidneys, lungs, heart, peripheral and central nervous system.
Can there be, because I'm thinking about my brother right now, because you are just giving such amazingly awesome information. When he had the skin rash, later he was diagnosed with sarcoidosis. If I'm saying that correctly.
Yes, sarcoidosis.
Right. He was diagnosed with that, but it was asymptomatic. He didn't have any symptoms and he didn't have any other organ issues.
And your brother clearly had 2 autoimmune diseases. He had sarcoidosis and he had lupus.
So they're separate?
They're separate.
Wow.
Just as rheumatoid arthritis or scleroderma or other autoimmune connective tissue type diseases which a rheumatologist would treat.
Now, is that common if you have an autoimmune disease that because your immune system obviously is attacking, healthy organs, if you have one, you're likely to have another?
Not necessarily.
Okay.
Most people who have lupus tend to just have lupus. They don't necessarily have to have sarcoidosis or scleroderma or Sjogren's disease, which I think Venus, the tennis star, has.
Really?
I think so, if I'm not mistaken. Serena Williams' sister.
Yes.
Most tend to have one, but you can have a combination. And there is a syndrome called mixed connective tissue disease where you have aspects of lupus, rheumatoid arthritis, which you manifest signs of them in different areas of the body or the skin. And again, a rheumatologist, would be the one who would, most likely diagnose those.
Okay.
Obviously,
Karen, you are killing it. I mean, you
you
are such a wealth of knowledge, and I know you guys are, it may not be the best thing you want to hear, but stay tuned because this could save your life. We'll be right back.
No lupus. No lupus. Lupus is one of those things that takes over somebody's body and you don't know anything about it. And it doesn't affect one person the same way it affects another. It's really a cruel mystery. We've got to find a way to get through this. No lupus. Go to lupus.org/no. There is hope.
We're back here and we have so much more information and we want to make sure we get this all in because this is very important. This could save not only your life but the life of a loved one. Now, Dr. Karen, you mentioned that sometimes having a stroke could be the first thing that happens in even young people. And when you see a young person come in who's had a stroke, that kind of, makes bells and whistles go off in your head that, this could possibly be something more than just a stroke.
Absolutely. Certainly strokes in young adults, we exclude the typical risk factors: high blood pressure, diabetes, heart disease, such as a heart attack, atrial fibrillation, unfortunately drug abuse. You always have to look for those risk factors.
Okay.
But especially in a younger adult, you want to exclude other things. You want to exclude coagulation disorders where you clot more easily and have possibly heart attacks or strokes. And you do screen for lupus, because, as I said, lupus can be a risk factor for strokes in certain situations. It's not the most common, but you must consider it. Because, again, you can get an inflammation of arteries in the brain causing vasculitis. You can get certain vegetations on the heart, which can be pumped to the brain, which can cause strokes in a person with lupus. And, of course, as a neurologist, we get brain scans such as CAT scans, brain MRIs, which we do ultrasounds of the heart like echocardiograms. We do CAT scans and MRIs of the arteries in the neck and the brain. It's called a CT angiogram of the head and neck arteries, or an MR of the arteries in the head and neck, which is called an MR angiogram of the arteries in the head and neck, as part of a stroke workup.
Now we talked about some of the rashes that are obvious, so if you have a rash and you've been told it's something, you've been given medication for it, it's not going away, please let that be a red flag. What are some of the other things that could happen that are not so devastating, like a stroke? Something simple like a rash. What are some of the other things that you might see that raises a red flag that you should go get checked out?
For lupus or other things?
Lupus or any autoimmune disease.
If you had some sort of meningitis, even if it's a viral meningitis, which they typically call aseptic or bacterial meningitis.
Right.
One thing the infectious disease doctors will do, they will check for all sorts of bacteria and tuberculosis and fungal infections. They will check for lupus because lupus is an autoimmune type disorder. I think the more typical things you might see, which people would say, well, it's not a stroke and it's not going to kill me. Sometimes the cranial nerves in the brain, which affect our vision, looking up and down, facial movements, can be affected by lupus.
What about Bell's palsy?
Bell's palsy can be a manifestation of lupus. It can be a manifestation of another connective tissue disease like Sjogren's disease or sarcoidosis. Facial numbness. Sometimes affecting the optic nerve or cranial nerve too can be caused by lupus or other connective tissue diseases. Sometimes you can get a muscle weakness or a myopathy from lupus.
Now, let me clear this up, because there's this rumor, and there's so many rumors about what causes what. I've heard that sometimes Lyme disease can cause things like autoimmune disease, like lupus, or like Bell's palsy, or like sarcoidosis, or other.
Right.
So what is the truth about that?
The truth is Lyme disease is its own separate entity, just as lupus is a separate entity, sarcoidosis is. Lyme disease can give the same type of central nervous system symptoms as lupus, but it is not lupus.
Oh,
okay.
I got
it's caused by a tick, and it's an infectious disease type process, and it can go into the peripheral and or central nervous system.
Right.
But it doesn't cause lupus, it's its own entity, but they can give similar symptoms. Ironically, Lyme disease, when it tends to present, since you brought this up, it tends to look more like a multiple sclerosis type picture on the MRIs. So, absolutely. And sometimes when we look at MRIs where it looks as though someone has multiple sclerosis, we always check for Lyme disease, and we also check for lupus, because they can give similar type pictures, not just a stroke type picture, but a demyelinating multiple sclerosis type picture. So Lyme does not cause lupus, it's its own separate entity.
Wow.
But thank you for asking that question to clear up any misconceptions.
Absolutely. Now, I want to talk just a little bit about the medications, because we know, or we have heard, I mean, you're giving me just a true lesson today, but steroids is the medication of choice, I've heard.
Yes.
For lupus or any type of autoimmune or anti-inflammatory, or maybe I'm saying it wrong. I'm not a doctor, but
that's all right.
But you go ahead and fix that.
Okay.
Is that the typical medication?
Steroid is a very common medication that is used to treat lupus or some of the other connective tissue diseases or autoimmune diseases such as Sjogren's or sarcoidosis, as you mentioned, possibly rheumatoid arthritis. Obviously, the steroid can be is usually given in pill form. Sometimes if you're hospitalized with it, it can be given in IV or intravenous form. Obviously, people say, "Oh yes, steroids have side effects. You know, you can gain lots of weight, and you know, you can get brittle bones." And so, to sort of offset that, and a rheumatologist will tell you, there are other classes of drugs that can be used with steroids or sometimes alone. And they call them immunosuppressants. And I mentioned Cytoxan or Immuran, which suppress certain parts of the autoimmune system and thereby treat the disease. With all of the wonderful developments and research that's done, the monoclonal antibodies, such as the Rituxan, rituximab, and others are being used for lupus and other connective tissue diseases.
Let me just ask you this, because I'm sorry, there's just so many things I want to know. If there's someone out there who is listening or looking at this show, what advice can you give them to let them know, if you see this, what are the next steps that they should take to move toward, to help them get the medical attention that they need?
Okay. Well, obviously, if you have any type of atypical rash, and you know, you'll go to your family doctors, likely possibly refer to the dermatologist. You know, make sure if there is any atypical skin manifestations that any type of skin biopsy is done. You know, ask about any type of lab testing. You know, not just to look for lupus, but for other disorders, which again a dermatologist would know about, which could cause skin manifestations. You know, if you are a person who's having strokes, obviously you want a complete stroke workup, you know, to look for the more common things, the diabetes, the atrial fibrillation, any atypical heart rhythms. But what other lab testing for strokes will you do? Will you screen for lupus? Will you screen for syphilis? Will you screen for atypical clotting factors, which might cause strokes? You know, those types of things.
Yeah, go ahead.
You know, if you are a young adult and you have suddenly, atypical or kidneys are not, working right, is there some sort of autoimmune, problem from that? Or, obviously, do you have a kidney stone or other more common things, but do we need to look for lupus, or do we need to look for any other disorders which could cause that? So you want to see the right specialist. Do not ignore symptoms. If there is any suspicion of lupus, please see a rheumatologist.
Excellent. Awesome. Karen, you have absolutely just been a wealth of knowledge. Thank you so much.
Thank you for having me on your wonderful show. And I just hope that your niece and brother and others, family members, friends,
with the information you gave, you
get the appropriate treatments.
Absolutely and definitely, that is a given. We thank you so much, and we know this has been a massively informative show for you. We want you to continue to join us and watch Living by Design and support our show, because we want to help improve our community and our health. Have a great day. We'll see you next time.